Hi, my name is Nicole Alafanti. Thanks for tuning in. Cure has been humbled and grateful enough to co-sponsor the film Aftershock. And I want to introduce you to Dr. Kira Bartlett from the Hudson Valley Birth Network and Nubia Martin. So, Kira, can you start with your network and why you're sponsoring this film?
Sure. Thanks so much for agreeing to participate in this with us, Nicole. We're so happy. I am a clinical psychologist and I specialize in reproductive psychology. So, what I do a lot of is talk to families about the experience of pregnancy and postpartum. And this is a function of a really wonderful organization that I am involved with and have been for many years called the Hudson Valley Birth Network, which is really a large group of people serving women and families in all different shapes, ways, and forms. So there are a lot of doulas, a lot of postpartum and labor doulas, there's midwives, there's chiropractors, there's lactation consultants. We have a lot of mental health practitioners, pelvic floor PTs. So anyone that is supporting families in this time is part of the organization. And over many years, we've tried to do as much as we can to promote the importance of really just education, because that often can be something that's so important for so many families and women that just don't know as much about how to stay informed and how to advocate for themselves. So in deciding to make this event, we really wanted to highlight something that is so important that's happening in the Black community that we just don't feel like is getting enough attention. In this movie is so deeply, deeply powerful. When we spoke, Nicole, you used the word intimate. It's exactly that. It follows two families who have been on quite a very, very tragic journey. And so we really want to bring attention to that. And we also want to help, most importantly, to help people take steps moving forward to be more educated and to change what is happening currently. So we're really happy to have the opportunity to do that. And super excited that one of the amazing midwives featured in the movie is part of our organization, Nubia Earth Martin. So thank you.
Yeah, thank you so much, both of you, for being here. So, Nubia, what is this film about for our audience?
Yeah, so I'll just start by saying I'm Nubia Earth Martin. I am the president and founder of Births on the Earth Inc., which is a nonprofit organization based in Yonkers. I consider myself to be a community birth worker. I have a master's degree in midwifery, but really the bulk of what I do is just call and response with the families in my community about what it is that they need. So I'll say this film holds a special place in my heart because the only reason I'm featured in it is simply because I had the honor of crossing paths very briefly with Amber Rose Isaac, who was one of the women who did not survive, birthing her son. And what I remember about this time, when this happened, we were at the very tip of the iceberg with the pandemic. There was a lot of, things being shuffled around to telehealth and in-person visits. And when Amber and her partner, Bruce McIntyre III, reached out, they were desperately trying to possibly switch to home birth, but really just trying to switch to a provider that would listen to her concerns. And I had the unfortunate, I guess, opportunity to be the one who looked over her lab work, because in order for somebody to be a good candidate for home birth, we have to make sure that they're healthy and low risk. So the first thing we ask after a consult is to send over, the prenatal records. And what was just so devastating, for me was to see that prior to the pandemic, from December of 2019, her care had been grossly neglected. And at that point, her platelet levels were in, crisis level. So to have to contact them back and say, unfortunately, you're not a good candidate for home birth, but more importantly, you need immediate in-person care. And then for that to kind of be mismanaged and Amber to no longer be here, that just really hit home. You hear a lot of the stories, you hear the numbers, you hear the statistics. about Black women and women of color and how they die, more. But when it's somebody that you actually had a chance to have a conversation with who was very excited about their pregnancy, it does hit differently. So the film um, does an amazing job of journeying with these two families, talking about their experience, but not leaving you feeling gut wrenched, which was really important to me if I was going to be involved in the film. But that it talks about what's happening in the community, what's happening within families to prevent this from happening. And the key word is prevention, because what we know based on evidence is that the majority of these deaths are preventable. So that means the good news is there's something that each of us can do to make sure that, this film brings awareness, but we're not telling the same story 5, 10 years down the road.
Yeah, just gonna sit with that for a second. So I noticed in the first 30 minutes there are two perspectives from the fathers. So when I thought of this film initially, I pictured a room full of women watching it, but it's important for men to see it too.
Absolutely. Right. I think, when there's a loss, you have to also think about the family that's left behind. So, these are now single fathers raising their children. And I think if we're going to talk about toppling maternal mortality morbidity rate disparities and the crisis that we're in, we have to incorporate the entire family, everybody who has a hand in this person's, care. And we have to make sure that the partners, husbands, mothers, grandmothers, aunts, sisters are all advocates and know how to speak up for somebody. And it's a skill that we can use not just in maternal health, but just in general health. If you go to your provider and you feel like your provider is not really valuing what you're saying, or maybe they're brushing off, what you're bringing to their attention. You want to make sure that that's documented. You want to make sure that somewhere that's being recorded, and then if necessary, you escalate it higher. And I think we put a lot of the onus on, advocacy and the maternal side of it. You're pregnant, so you should advocate. You're the one, but it really takes the entire community, the entire village, the entire family. So watching the film and how these two young men have turned their pain into power and have, changed policy, they've, amplified these stories, not just as a tragedy, but as there's something that we can do, that we can actually participate in. They have created foundations that are dedicated to bringing awareness and education. So that feels like, okay, it's time for us to really extend our embrace to the entire family, and that means including fathers in the equation.
And how can just people in general be part of fixing this problem?
Yeah, I think for sure, amplifying the message like we're doing with Hudson Valley Birth Network, showing the film, because I think people have an idea of what's happening, but to actually, watch the film, in its entirety and get some of the history behind where this issue is stemmed from. Like, this is not something that just happened overnight. There's been, systematic things in place over the years. So in order to tackle that, in order to kind of battle that head on, we have to know the history. We have to know how we got there. So I think educating ourselves, and then seeing what's happening in your community. And if there's not, an campaign or something actively taking place, create it, there's no harm in there not being something in place, but there is harm in not actively creating something if there's a space to do that.
Mm-hmm. Great. Yeah, and I only got into 30 minutes, and I'm going to watch the rest because it is on Hulu for those who can't make it to this event that's coming up. But I was grateful that I had just gotten into the piece of history, and I think that's really important. Like you said, this is systemic, and we did call the father of gynecology, Marion J. Sims, right? This doctor who used and violently abused Black women's bodies to understand the uterus, right? So the fact that we really can't dismiss that and how it connects to today, and whether it's conscious or unconscious bias that lives in the way the medical profession is rolled out and the way people are taught. and the stats all over the country are just that are in this film are devastating. So in the way hospitals and different spaces and places in the medical profession deal with Black women. So that's a piece. Yeah, Kira, I'm sorry.
I think one of the other things that really feels important, at least in terms from my vantage point, is trying to figure out how to get into the minds of the doctors and the nurses, because it feels like, I mean, there's so many layers to this, and I'm not clearly I'm not fully comprehending all of it, but I think one of the things that feels crucial is starting to educate doctors and nurses differently about what they're looking for and also what they're hearing and how to take that seriously. Because I do think that your point about implicit bias is definitely there. I'm sure that there are much in the way of things that are left over from so long ago, but it does need to be taught in medical school, in nursing school, in a way that it is not now. And so that feels like another kind of avenue of what can you do? Like if you have any impact on that, you can do something about that as well.
Mm-hmm. Yeah.
And also was just the idea that in some ways, I think what makes this documentary so powerful is that you can hear these numbers and they're gut-wrenching and awful. But when you really, like Nubia, like you said, when you meet someone or when you hear someone's intimate, personal story, when you see the partner that's left behind, when you see the child that is now motherless, like these are the things that are so, I think, crucial for us to be able to see up close and feel awful about, because that's what can motivate us to do more and to try to change this, because it's just unacceptable. And Nubia, I think you said if this was happening among white women, this would be, it'd be a completely different situation.
Right. And I do appreciate that the film does touch on, the medical industrial complex and the things that need to happen there. Dr. Shah is in the film, and he does an incredible job of rolling out, some simple changes that can happen on the maternity floor to improve outcomes, which I think it has to come from a doctor's mouth sometimes, for it to be, validated. And I appreciate him, stepping up and saying that. The other part that's touched on in the film is that, midwifery is a big part of the solution, because, it's hard to give somebody quality care when you have to see them in 5 to 10 minutes, right? And that's what happens within the medical industrial complex or within clinical care in that type of environment. And if we reserved hospitals and OBGYNs for care for those who are having a more high risk, pregnancy and need that level of care, and had midwives as the primary providers for those who are healthy and low risk, we wouldn't have a system so overrun with people that you can't give, everybody 100%. The midwifery model of care is one that is individualized care, which means that if I'm caring for, Kira, it's going to look different than caring for Nicole because of, what things they might need, because of what things they might want, and when we look at evidence-based research, they say the safest place for those who are having a healthy, low-risk pregnancy to give birth is not in the hospital, and that about 85% of pregnancies are healthy and low risk, yet 98% of people birth in a hospital. So I think it's just about, educating people about their options, and then also talking about, how to keep that pregnancy healthy so that you do have all the options, hospital, home birth, birthing center at, your disposal.
Mm-hmm. And I just want to make one more point. I think it's, we're seeing this across socioeconomic lines. We're seeing this across how educated or not educated someone is. So we want to be clear on that point as well,
Yeah.
I think.
Yeah, we're seeing, Serena Williams have a complication, and I'm like, she's one of the most powerful, richest people in the world. She's not a wallflower. She speaks up for herself, So years ago, it was, well, they're not getting, prenatal care. They're not educated. They're unemployed. And it was actually proven that even if a Black woman has multiple degrees, is in the middle to upper income level, if she gets prenatal care from, the moment she finds out she's pregnant, she still fares worse than her white counterpart who is unemployed, did not finish high school, and gets no prenatal care. So it's not about whether somebody gets care, it's about the type of care that they are getting.
Mhm.
Well, I know you have lots to do today and every day, so I don't want to keep you. I appreciate your time so much, both Dr. Bartlett and Nubia Earth Martin. And so the film screening is April 16th, 12:30, Kira, at the White Plains
Correct.
Library. Is that right? Okay.
Yes.
Okay.
Yeah.
So April 16th, 12:30, White Plains Library.
We
After
really
the
sorry. I was just gonna say we really hope people come out because we will have a panel discussion afterwards. And Bruce McIntyre will be there, as well as Mila Flores, who's also featured in the film. And Mila has the Womb Bus, Bruce has the Save a Rose Foundation, and the three of our organizations, have been supporting each other to make sure that families are getting, what they need. And we'd love to just, have a conversation and answer questions from the audience and have it be an interactive. So it's not like you just watch the film and you leave kind of like so much thoughts and feelings. You have a space to actually have a discussion, about that and talk about active solutions.
A hopeful event. So I hope everyone shows up. I'll be there. And thank you so much for your time. I really appreciate it.
Thank
Thank
you.
you.